Welcome, everyone. It is a pleasure to be with all of you this evening discussing healthcare leadership at the intersection of environmental justice and healthcare policy. Today, we acknowledge the vital link between the health of our planet and our communities. As healthcare administrators, we hold the key to driving systemic change that not only preserves the well-being of our ecosystems, but also ensures equitable access to quality healthcare for all. This event is a testament to our shared dedication to creating a healthier and more sustainable future for generations to come. And to help give us strategies and walk us through a discussion on this topic, I'm incredibly grateful to introduce our speaker for the evening, Brent Peterkin. Brent is a social impact strategist whose leadership experience includes roles as statewide director of Project Longevity, executive director of Gather New Haven, and manager of government affairs and community relations at Stanford Health. His focus spans social justice issues, including criminal justice, gun violence, environmental justice, food justice, early childhood education, and health equity. He has contributed to social change by serving on nonprofit boards and participating in initiatives such as the Governor's Youth and Urban Violence Commission and the Bridgeport Mayor's Initiative for Reentry Affairs. Thank you, Brent, for joining us today, and I'll turn it over to you.
Thank you so much, Taylor. Hello, everyone. Good to see you all. And I'm going to go ahead and share my screen. Okay, can you all see my screen?
Yes.
All right, so looks like Zoom made a few changes, so hopefully this all works out well. All right, so once again, my name is Brent Peterkin, and I'm here to have a conversation with you all about environmental justice and framing it as a community health issue. And I think that most of this will be intuitive for you all, and I expect you to see why as I go through this presentation. I only have a short amount of time to get through a lot of content, so I'll be brief and skip to some main points on each slide. Okay, so just some of the key objectives that I'd like to go over today. One is establishing environmental justice as a community health initiative, or the linkages between the two. Review some environmental justice policies and also some public health interventions. I'd like to read a quote by Dr. Robert Bullard before I continue to the next slide. When you don't protect the least of your society, you place everybody at risk. Justice will say, let's do fairness, equity, and justice to make sure that we do not somehow say just because you live in a low-income neighborhood that you don't deserve to have a park, a grocery store, and flood protection. And so climate change impacts everyone. And we've been facing environmental justice issues for decades. And environmental justice or environmental detriments to health are an established part of the social determinants of health. The two are inextricably linked. As we live in a biosphere, and everything that occurs in the biosphere, whether it prohibits certain activities or access points to healthcare or lifestyle choices, ultimately affects our healthcare system and the people within our community. So I'm just going to go over a few definitions, which are commonly used terms, and one on the next slide is not so much of a commonly used term. So environmental justice essentially is defined in many ways, but most would agree that it's about people and communities having the equal right to environmental protections under the law, and the right to live, work, and play in communities that are safe, healthy, and free of life-threatening conditions. So it's more so about playing defense and making sure that people and the lands are protected from environmental detriments, typically caused by industry and in some cases by government. Natural environment. The natural environment consists of land-based ecosystems such as grasslands, forests, aquatic ecosystems, rivers, wetlands, marine systems, mangroves, you name it. I'm a son of an immigrant family. My family is from the rural parts of Jamaica, and Being in Jamaica as a child, I was blown away about just my family's ability to harness the natural environment for many different things, whether it be for food and provisions, whether it be for just peace of mind and tranquility. My grandfather was a farmer, and it's pretty much in my DNA to be connected to nature in some shape or form. And the reality is that we've spent as a species more time in nature than we have in the built environment. And therefore, when you spend time in nature, you may notice a common feeling, a sense of tranquility or serenity or solace, and that is being commonly phrased as the biophilia effect. And in some countries like Japan, people actually practice forest bathing as a therapeutic modality. And the built environment, it's the man-made environment. It's everything that you see around you, whether it be the buildings that you're housing, your home, your apartments, the highways, the roadways, the sewage systems, pretty much everything, recreational spaces, parks, these all comprise of the built environment. And environmental racism, it's really more about going on the offense and really scoping out ways in which people have been intentionally prohibited from engaging in environmental justice activities or environmentalist activities, or have been intentionally harmed or neglected by people or organizations, typically companies, that have negative externalities that harm the environment or place harmful environmental hazards in close proximity or directly in communities of color. The next term is a bit of a controversial term. It's the Anthropocene. And throughout the course of history, essentially, we mark off periods of history in which there's been geological shifts. The most commonly used term is the Holocene, which would mark our period of time in history. A term that came about just a few years ago, Anthropocene, essentially our impact on our environment. And what scientists are saying here is that this is the first time in the history of the planet in which humankind is actually shifting the ecology of the entire environment as exhibited and demonstrated by climate change. And human ecology, it's essentially how we comport with the natural environment. It's how we function in the natural world, how we function in the built environment, how it impacts us. It's about the symbiosis between humans and our environment. And so I'd like to just cover a few noteworthy leaders within the environmental justice community. These are folks who are national notoriety. Dr. Bullard, he's often referred to as the father of environmental justice. Dr. Bullard emerged as a prominent figure in the 1980s, but I would say that his passion for environmental justice goes back to his early childhood. He's been advocating for communities of color for decades. He's written 18 books, and he's essentially championed and helped to provide structure to the concept that we know of as environmental justice. I'd like to shout out a few other people like Karen Washington, who is an urban agriculturist. She is in the Bronx, New York, and she coined the phrase, or she's most known for coining a phrase or amplifying a phrase known as food apartheid. And so we commonly hear terms like food deserts, but a desert denotes sort of something that's naturally occurring, or the absence of certain kinds of resources. But food apartheid points to the intentionality of urban planning and design, and where people are placed and how or to what extent they have access to resources in their community, particular food resources. And then I'd also like to highlight Rue Mapp. Rue Mapp is a nationally recognized speaker and outdoor enthusiast, and she launched a national organization that has chapters all over the country, and I believe even internationally, called Outdoor Afro. And Reverend Benjamin Chavis Muhammad is actually the individual who coined the term environmental racism. And so now we have here the principles of environmental justice. And so as you can see, the screen is pretty full. There are actually 17 principles of environmental justice. The principles of environmental justice were established in 1991. They were adopted by the first National People of Color Environmental Leadership at the first National People of Color Environmental Leadership Summit, which is held in Washington, D.C. And essentially, these principles, codify the ethos of what the national environmental justice movement is about. And just to note that historically, white folks essentially functioned as environmentalists, right? They advocated and fought on behalf of protecting the environment itself. Contrasted with environmental justice activists, which fought for the rights and benefits and justice for people of color, primarily Black people who were harmed by environmental hazards caused by corporations and neglect. I think there are three principles of justice that are noteworthy and germane to our conversation. The first one is number 7, environmental justice demands the right to participate as equal partners at every level of decision-making, needs assessment, planning, implementation, enforcement, and evaluation. The second one, number 9, environmental justice protects the right of victims of environmental justice to receive full compensation and reparations for damages, as well as quality healthcare. And number 16, environmental justice calls for the education of present and future generations, which emphasizes social and environmental issues based on our experience and an appreciation of our diverse cultural perspectives. And so I'm going to walk through these 3 principles of environmental justice and just highlight a few key points on how we can, bring them to fruition in our daily walk or through our careers as health service professionals. And so environmental justice, folks, health education, I think touches on principle number 16. And whoops, I skipped the slide, excuse me. So the environmental health detriments impacting communities. And so this goes back to some of the points that I made in that environmental justice or environmental health hazards or detriments are inextricably linked to social determinants of health. And so if we look at environmental health detriments that we've all seen, either within our towns, our cities, or on the news, whether it be wildfires, blight, things like urban heat island effects, something that I had a family member experience in Philly, where certain parts of the city, because they lack a tree canopy, tend to be hotter and warmer than other parts of the city or within the county. And that can cause significant impacts on residents who live in the area. And there's things like industrial pollution, light pollution. If you grew up in a big city like I did, I'm originally from New York. I didn't see the night sky until I moved to Connecticut several years ago. And then there's like legacy pollution. So pretty much all of Connecticut's major cities are post-industrial cities. If you've been to Hartford, New Haven, or Bridgeport, you've seen dilapidated, empty factories or warehouses. Essentially, there are hazards and heavy metals that have pretty much, made the ground toxic. And those pollutions end up pretty much either in our drinking water or within our waterways, or they create things like brownfields, which create environmental hazards as kids tend to play in vacant lots or enter vacant lots, not realizing that there are heavy concentrations of heavy metals within the ground itself. Now, these detriments produce health effects. And the health effects are wide-ranging, and it's hard or difficult for healthcare practitioners or clinicians to identify ways in which some of the illnesses that their patients are presenting with are actually attributed to the environment itself, which will also dictate lifestyle choices for preventable diseases or chronic issues. So things like cancer, heart disease, even dysthymia, right, which is a sustained period of just melancholy or sadness. And over time, if it sustains long enough, you can be diagnosed as being depressive. And if you're in an environment that has significant urban blight issues, or there's traffic, air pollution, or you're in an environment that lacks green spaces, these things impact you psychologically. And if you're not proximate to green spaces, you could also experience nature deficit disorder. But also when you think about the built environment, it does take into account public safety. I spent a lot of time when I worked on gun violence in Hartford, and I would walk the streets of Martha Avenue, walk all around Albany Avenue on the side streets, and oftentimes people would be concerned, they would stay home, and that limits their ability to get outside, get some fresh air, and enjoy nature. And so you do find sometimes that folks experience nature deficit disorder. This is also recognized during COVID shutdowns. And then there's demographics. A lot of these these environmental detriments and health effects tend to be concentrated in communities of color that also happen to have low medium incomes and other demographic issues that point towards socioeconomic disparities. Number 16, I think, brings us to environmental justice focused health education. And so it is essentially incumbent upon us to make sure that we are incorporating environmentally justice infused health education resources in discharge planning, as that's an opportunity for patients to be informed about some of the environmental impacts that could be causal factors or contributing to the exacerbation of health conditions. We should also consider exploring nature-based adjunctive therapies for cognitive and behavioral health issues. There are many different nature-based therapies, and merely just exposure to the natural world can help folks who are suffering from traumatic stress disorder, and even children who are on the spectrum, as there are many opportunities to facilitate learning and development in the natural world. I would also encourage healthcare service providers to routinize and launch health education events in collaboration with environmental focused organizations. I think that synergy can amplify connection community better on the decisions and also their advocacy efforts as well. Develop informational resources that show linkages between healthcare and environmental health. This can be done infographics, this can be done through social media postings, this can be done through media presentations on YouTube or other platforms as well. And then lastly, partner with environmental justice organizations and also your Department of Health and engage with them, not just on conventional medical issues, but also environmental issues. And so you can identify nexus points in which you could perhaps collaborate to improve the quality of life and community well-being in your neighborhoods. The next one is engagement in environmental justice focused policies. So one of the things that is fairly recent in Connecticut is the establishment of the Connecticut Equity and Environmental Justice Advisory Council. Now, folks who sit on this council are appointed. However, currently, there are no seats allotted for folks who come from healthcare industries or healthcare professions. And I think that's an opportunity to have some inclusive contributors from this sector weighing in on environmental issues and how they impact the health needs of our communities. And I would also encourage the expansion or the inclusions of healthcare professionals, particularly on municipal planning and zoning commissions, food policy commissions, parks and recreations. And if that's not feasible, they tend to aim for subject matter experts, but that narrows the dialogue, I find. Like, yes, you want a civil engineer, but you may also want a pulmonologist, right? Sitting on some of these commissions. But at the very least, you can submit written or in-person or virtual testimonies advocating in opposition or in support of policies that are being passed at the state or local level. So let's take a look at some federal government policy initiatives. So President Biden launched what's known as Justice 40, and Justice 40 essentially is all encompassing. It pretty much invests billions of dollars into addressing climate change issues, whether it be mitigation based efforts or whether it be efforts focused on environmental justice. And about the 40 and Justice 40 essentially says that across federal agencies, 40% of the benefits that's attributed to their programs that are funded through the Justice 40 initiative have to support disadvantaged communities with a particular emphasis on Black and Brown communities. And so there's about 399 covered programs, I counted them all, across 19 federal agencies that are implementing the Justice 40 initiative. I'm not going to tell you which way to vote, but November is critical, as there is many conversations about shrinking government and eliminating such programs, like the Department of Labor's program that supports reentry employment opportunities, in which formerly incarcerated individuals get trained on green jobs and develop skills that are applicable to the green economy, which provides them with an opportunity for a second chance in a growing and emerging sector. So at the state level, Governor Lamont has also invested a significant amount of resources. I would say notably, he did this with Executive Order number 21-3. And one of the things that he did was create the Deep Climate Investment with the Department of Energy and Environmental Protection's Climate Change Fund, which allows for Connecticut municipalities and also other vulnerable areas to invest in climate mitigation resources, infrastructure improvements, which are critical, particularly in cities like Hartford, that have been impacted by flooding for years. And this is a form of neglect because the areas of Hartford that have been impacted by flooding are predominantly Black African-American communities. And so as a result of just the environmental degradation that has impacted many residents for decades in Hartford and that neglect, people are now being compensated by the state upwards to $5 million in aggregate, deal with some of the structural damages to homes, businesses, and then the state has also created a $170 million fund, a part of which is subsidized by the federal government, to create climate mitigation resources, to revisit the levees that support Hartford, the drainage systems, the sewage pumps, so that we can handle increased rain, rising sea levels, all of which have been perpetuated by climate change. Governor Ned Lamont said it himself, that if this were a predominantly white community, a suburban community, these issues would not have persisted for decades. This is a form of environmental racism, and I'm glad that it's being called out and that the state is taking initiative to address these issues. Here's a legislative update. These are some bills that are currently being legislated during this session. The one that I think stands out to me most, would be Senate Bill 191, which is concerning food scrap diversion from the solid waste stream, and also the redemption of out-of-state beverage containers. But I think food waste diversion is pretty much the essential part of this bill. And so about 30% of the waste that ends up in Connecticut's solid waste stream comes from food scraps. Those food scraps could be composted, and they can support urban agricultural initiatives. But also, if you go into a supermarket or a restaurant and it's near closing, they're throwing away tons of food that can be recovered and donated to food relief organizations. So Senate Bill 191 essentially creates a statute that mandates that food service organizations, which may include hospital cafeterias, to take their food waste that's recoverable and partner with the food relief organization and donate this food so they can get into the households and in the hands of needy families. Another thing that Connecticut has taken initiative to create with the support of UConn and also the federal government is the Connecticut Environmental Justice Map Tool. And it's a spatial information system that maps out the entire state. There are multiple filters. I spent a great deal of time with it myself. One of the things that you'll see is that particulate matter, which essentially is the diesel waste, the carbon emissions that come off our highways, in which many communities of color are proximate to. About 70% of Black people in Connecticut live in major cities and are disproportionately impacted by carbon emissions. And we're looking at, air particulate matters that tend to settle in the lungs and either create respiratory illnesses or exacerbate respiratory illnesses. And then there's also affected facilities. And so it just turns out that facilities that produce environmental hazards like incinerators are actually located in communities that are predominantly Black or predominantly communities of color. And this overlaps with some of the cumulative issues that I talked about earlier that would establish a distressed community, things like low, medium household income, food insecurity, chronic illnesses, low life expectancy. And so when you take a look back and you look at it from this level, it's clear to see that this is a race-based issue. This is a segregation issue when you think about the concentration of people of color in urban centers. And the fact that you won't find folks being relocated to other municipalities for which there's adequate opportunities for affordable housing developments, in particularly due to NIMBY. Some of the things that we can consider are community-based initiatives. One of the things that I would encourage you to consider doing, many healthcare organizations have formed DEI committees. Consider forming an environmental justice committee at your healthcare organization, and then encouraging your leadership, or if you're a leader yourself, sponsoring a needs assessment, which may tie into your community health improvement plan or your community health needs assessment if it is pronounced by your community members. But they may not make the connections between environmental justice related issues and also health issues. A lot of times, especially in Hartford, folks look at issues like the flooding that caused structural damages as an economic issues, but there's an opportunity there for the healthcare community to have health education events and talk about things like mold exposure and other hazards that came from flooding issues in Hartford, for example. Again, I'll reiterate, advocate for the inclusion of healthcare institutions, providing them with seats on the Connecticut Equity Environmental Justice Advisory Council. This puts you at the forefront of advising deep on policy initiatives, as they pretty much are at the center of environmental justice issues, along with the Department of Public Health, Department of Transportation in the state of Connecticut. Collaborate with your government affairs professionals, or independently submit written testimonies or testify at public hearing. Just a few weeks ago, there was a slew of public hearings. You get 3 minutes on the mic in front of your state legislators to share your opinion, whether in support or in opposition of proposed legislation. This positions you as a healthcare leader to advocate on behalf of not only your organization, but also your patient populations or your constituencies. Convene responsive community roundtables. Having relationships with environmental justice focused organizations is key. These relationships should not be formulated in basically under the circumstances of a crisis. We should be proactive and engaging in identifying opportunities for synergy. And then consider supporting organizations through sponsorships and also promoting access to nature-based activities as a remedy for some of the environmental detriments. Supporting things like urban farms and community gardens address a number of issues. Number one, they provide biodiversity within the community. They provide access to fresh, healthy foods in communities that are impacted by food apartheid. They also provide an opportunity for people to learn and grow with nature, and to take on more ownership, if you will, of what's going on in their environment and how the natural environment can benefit them within an urban setting. And then also supporting community-based organizations, like in Hartford, there's Knox Farms, there's the Brass City Harvesting, Waterbury, there's Gather New Haven in New Haven. These organizations tend to focus on urban agriculture, but there's also organizations like Outdoor Afro, which may benefit everyone who's sitting here listening to this presentation. I encourage you and implore you for your own mental health and wellness, for your own physical health and wellness, get out, get outdoors, spend as much time in nature as possible. It is therapeutic. It supports and facilitates work-life balance. We all carry a great deal of weight on our shoulders. And then by supporting organizations like Outdoor Arrow, it creates more visibility for folks who look like us within nature-based settings. As if you spend any time on the trail, you'll find that we are in the minority indeed. But the more of us that are out there, the more familiar people get with us and understand that the outdoors are for everyone. One of the things that I did in a previous role as the executive director of Gather New Haven was we launched a health and wellness and nature-focused community festival. And we did it at the Gale Field, also known as Gulf Street. We conducted a needs assessment of that community and examined the needs. And we wanted to bring the conversation, essentially imploring the community to consider what nature can do to address community health and wellness issues. And it was a fantastic event. We had 39 vendors. We were sponsored by Yale School of Medicine, Yale New Haven Health, federally qualified community health centers as well. And so it was all encompassing in terms of demonstrating the integration between environmental justice and healthcare or public health organizations. It brought the conversation with some entertainment and fun to the community about how the environment can play a role in health, the health of the community, but also why environmental justice issues should be at the forefront of public health conversations. So that concludes my conversation. I realize I went over time. I do apologize for that, but I'm happy to answer any questions that you may have.
Thank you, Brent. Thank you so much for this great discussion. It has been very informative. We do have some time for questions, so we'll now begin our Q&A. I invite our attendees to ask any questions in the chat or come off mute. We will try to get to all questions, and while we start, I'll start with a first question. So with busy schedules, Brent, and the cold winters, what are some things you do to incorporate nature time?
Hike. Yeah. You can hike pretty much any time of the year. I think sometimes when you don't have leaves on trees and it's not burdened outside, folks tend to think that it's easier to stay indoors, but if you layer up, put on a base layer, put on a fleece or a sweater and a nice winter coat, some warm footwear, some thick socks, there is something to appreciate in the outdoors at all times of the year. I'm chomping at the bit to get outdoors now because I'm also a birder and into bird photography, and this is the season. But I would say, hiking is probably my go-to.
Thank you. And Ed, I see your hand up. You go ahead.
Thanks. Yeah, Brent, great presentation. I personally learned so much. I'm curious for specifically environmental racism, which it seems, at least I'm learning today, it seems to be the intentional efforts by either an organization or by political leaders to enact harm on a group of people through the environment. Have there been any examples of people or organizations being held accountable for environmental racism?
Yes, there is enforcement, and particularly by industries that have extricated or left certain communities, like in New Haven or Hamden and other municipalities that have pretty much left the environment in disarray. So some organizations and pretty much you can find this all over the country have been held accountable either through fines, some of them brought up on criminal charges, but on the federal level, the EPA will establish if it's a significant environmental detriment, it can go as far as the EPA establishing a Superfund site, which means that the site is extremely toxic and hazardous, and they will take over and basically remediate the site, clean it up of any environmental pollutions. But they will also levy a hefty fine from an organization that has demonstrated some sort of negative externality as a result of their manufacturing or production processes, whether it be wastewater runoff or pollutant of the air or something intentional done to the environment. But typically you'll find that institutions get fined. Another example of environmental racism is what I talked about earlier. And it could be the placement of things like incinerators. And so one of the things that Governor Lamont did was he essentially established policy that requires community involvement in the permitting process. And so before it was more or less a suggestion, now it's a mandate that any entity that's looking to create a facility like an incinerator or waste disposal or recycling or whatever it may be, they have to engage the community in a very forthright way, provide reporting, updates, proposals, explain it in layman's terms, in addition with consultation from regulatory agencies before their permit is approved for them to conduct business. So essentially it puts Black people in a position to say, NIMBY, not in my backyard, and be opposed to things that historically they haven't really had an opportunity to speak out against. And so on one end, you have the intentionality piece, but you also have, I think, moreover, and what's more prevalent is indifference. The reality is a lot of times they just don't care, you know, and that's how situations like what we see in Hartford occur. You know, the flooding has been going on for decades. There have been people who reported that their homes have been flooded 3-4 times. And it's just now that there is action being taken to implement climate mitigation resources to prevent future flooding and to provide cash compensation to repair homes that have been damaged by flooding.
Thank you, Brent. Oh, Frank, you have one last question?
Yeah, hi. Thank you, Brett. Truly learned a lot. I appreciate you coming to talk to us. I I might have missed a little bit, but I wanted to know if you have done any work with or are familiar with the CHPCA, the Connecticut Health Professionals for Climate Action. It's an organization based here in Connecticut, composed of healthcare professionals, primarily based in Hartford and New Haven. So they recently provided legislation and for the climate action bill. And I think that, it's a great organization. I've been able to participate with the organization, and they're really passionate and like ready to contribute legislation. Some op-eds have been written about the impacts of climate, or the impacts of pollution on human health. But I know that they're looking for more organizations to partner with. So I just wanted to, yeah, give that shout out there. But yeah.
Thank you for bringing that up. Regrettably, I have not had the opportunity to engage with those folks, but I appreciate any introductions. I'll also just Google, as well. And so I can learn more about what they're doing and what they're looking to propose at the legislative level, and also what they're looking to potentially do in practice within communities. I think that there are so many things for healthcare providers or healthcare organizations to focus on, especially within clinical or acute care settings. But if we're not thinking and operating beyond the walls of the offices or hospital systems of providers, essentially, we're not getting on top of the issue. Policy mandates help, and what I also suspect is that issues like the reduction of carbon emissions that are being imposed across state agencies. So they have a mandate that's been imposed by Governor Lamont over the next few decades to essentially be net zero. I suspect that the Office of Healthcare Strategy will begin to implement such measures if they haven't already. I don't believe they have, into the certificate of need process. And other mandates as well that will be attached to certificate of need approvals that will directly have an implication on community health and well-being as it relates to environmental justice issues.
All right. Sorry. Oh, Brent, we have one more question in the chat from Jade. So she wants to know if there are any state or Medicaid funded behavioral health programs for children or adults.
I mean, there is. The problem is that it's underfunded. And so, if you're uninsured or underinsured, you're faced with a lot of challenges, as there is a significant demand for behavioral health resources. um, especially on communities that are disadvantaged. A lot of behavioral health providers, clinical therapists, have options, like in Fairfield County, they have the options of, working with clients who can self-pay. And so you get a deluge of patient populations on a small amount of behavioral health professionals to service their needs. And there is a significant capacity issue. And a part of that is because folks who rely on Husky, Husky doesn't provide the reimbursement rate that many behavioral health specialists are looking for. There are also adjunctive therapies that can be put into practice as well, which they don't meet the level of clinical supports, but they are very helpful. And there are things that folks can do on their own or with guidance in connection with nature.
All right. So I'm going to turn this over to Elizabeth, but I want to say thank you, Brent, for this incredible discussion. It has been very informative. I know I've been enjoying this, so I'm going to turn it over to Elizabeth to close us out.
Thank you so much, Taylor. And thank you again, Brent. As Taylor just mentioned, we did have one more quick question. Favorite trails in Connecticut? Any recommendations?
Favorite? I don't have a favorite trail. I kind of like to just wander and meander through the woods, but when you're bird watching, you got to be still, because they're not out there the birds aren't there to pose for you to take their pictures. So I spend a lot of time when I'm on a trail pretty much being stationary and trying to spot birds and get a good shot. But I would say my favorite trail, if I had to narrow it down, would be one at my former organization, which is in Quinnipiac Meadows, which is in the Fairhaven neighborhood in New Haven. It's just a loop trail. You can get through it in about 30 minutes, but it's right by the water. So I enjoy stopping and sitting by the water and just relaxing and soaking in nature.
We love it. Thank you so much. And that sounds quite relaxing. So we'd like to thank Brent again. Thank you for taking the time for bringing us through such a comprehensive discussion. There's so many tie-ins to how we do our work with patients or even with programs that we're running. So we appreciate the perspective. I also want to thank and acknowledge all of our leaders here at NAHSC. And I'd like to acknowledge our members at large as well, Dr. Selena Osei, Kenneth Waller, as well as Bridget Fegan. And I lastly want to acknowledge every single one of you for coming, for showing up, for asking questions, for engaging at NAHSC. We're really wanting to create opportunities for us to expand our understanding and our learning through different ways. So having a conversation around environmental justice and the intersection with health was really meaningful for me, and I hope the same for you. So I'd like to thank each of you for your participation.